The Honourable Annette King.
Mr Chairman, I'm so glad that the Minister has joined us for this debate, because one of his colleagues was in the chair a moment ago, Minister Woodhouse, and he talked about how proud he was of this government's record in health. And I listened, be positively puffed up, you know, the hyacinth bouquet of the Parliament. But I have to say that I listened to some of the things that he said, and I was questioning them, I have to say, Minister, because he said there are 50,000 more operations that have been done under this government. And I know for a fact, Minister, that you're counting 12,000 of Labor's operation done under the 2008-2009 budget, counting it dishonestly as operations done by the National Party. Oh yes, they are. 12,000 of them.
We'll just freeze that, and I'll just warn the member that just accusing a minister of being dishonest
I
or
didn't
doing
say
something.
he was dishonest, Mr Speaker.
Well, I think the member will now sit down. And you know, also it's been ruled many times accusing a government or a ministry of doing something is the same as accusing an individual member of it, especially the member in charge of it. So I'm just asking them to take more care.
Let me just rephrase. A very misleading claim by this government that they've done 50,000 more operations, counting 12,000 done under the 2008-2009 budget. Will the minister deny that? I will table it and show that that is correct. And I find that very misleading. He then went on to say we're sending no patients to Australia for cancer treatment. Well, I'm glad we're not, because I had to. 2000, 2001. Does anyone know why I had to? Because they received a report from the National Party in government in 1998-99 saying our cancer services were in dire strait, we did not have enough linear accelerators, we did not have enough staff, and that we could not provide the service. Do you know, it took me months to get that report out of that minister. I asked for it, they didn't have it, never heard of it, denied it. I knew it existed because I did have a copy. And I was testing the minister and his ministry about being honest about cancer treatment. And so, Mr Speaker, Mr Chairman, what I think is happening in this health sector is there's $1.7 billion missing in the health budget. If you look at the budget and you look at the track that it has been on, $1.7 billion is missing because they have not covered costs and they have not covered all the demographic growth. And that is not coming from Labor. That was independent work done by Infometrics. And the government has denied. But we're now starting to see the impact of those missing dollars. And we're seeing it in research that has been provided over the last few weeks. And the minister might want to deny this research, but it has been done by the Otago Medical School. It is proper research, printed in the medical journal, and it has said something I think is very significant, and I don't think the minister has read it. It said patients undergoing primary elective total hip and knee replacements in Otago in 2014 are more severely disabled than between 2006 and 2010. Patients currently returned to GP would have qualified for publicly funded surgery during that period. This paper confirms that the increasing demand is not matched by the increase in supply. The problem we describe are likely to become increasingly widespread across New Zealand. That is research, proper research, given to the government, denied by the Associate Minister last week, and continue to be denied by the Minister himself.
Order.
And we also now know, because of data received from the Ministry of Health, that we have 8 DHBs who have been unable to provide the number of elective surgeries that they were expected to provide going right back to 2011. 2,181 procedures, hip and knee procedures that were supposed to be provided that were not provided during that period. And I have to say to the Minister, why weren't they provided? Of course, we know what he thinks. He said patients only think they need surgery. They don't actually need surgery. It's all in their mind. And I challenge him to go and tell Grey Power that when they're asked if they believe they need surgery because they're in pain and they can't walk and they can't go out and they're now housebound, whether it's all in their mind, have a listen to what they might say, Mr. Chairman.
Mr. Chair.